Hi, nurses. Thank you for coming and taking some time to be with me. I have a few thoughts that I'd like to share with you. Have you ever wondered how a patient's sex in general plays a role in their health care? Some people think sex and gender are the same thing, but this has been proven wrong. The difference between the two have separated, forming categories of their own. The sex of a person is biological, and the gender of a person refers to socially constructed roles assigned to each sex. Examples of female roles include cooking, cleaning, and being agreeable, where examples of male traits include hunting, providing shelter, and aggression. It's important to consider this when treating your patients. Your patients sometimes can create an uncomfortable situation. I began researching this topic because of one such encounter. I have a story for you. I had a patient early in my career, and he was sitting in the exam room. And when I walked in, he looked like a man, he smelled like a man, and he carried himself like a man. But the chart that I was holding had female information on it. Okay, so as I sat down, I asked him what his date of birth was and the name, and he assured that it was correct. So I proceeded to ask the patient what his symptoms were and why he was being seen. And he complained of flu-like symptoms with nausea. Okay, so obviously, being that the patient is documented as a woman, I have to rule out pregnancy. So I had to ask, when was your last menstrual period? And he instantly turned red. I instantly turned red. And what caught my attention was that he kind of puffed up his chest when he answered me. And I determined that that was a male unconscious reaction and defense mechanism for this patient. So I continued to address him as him, and we got through the visit. He's, was diagnosed with flu and sent home for a couple of weeks. And that was my first encounter with gender-based healthcare. And since then, I found it interesting to study and see the lack of gender-based patient care that's available. The prevention and management therapy for these patients is very hard to find. It's hard to find someone that they can talk to on a professional level. So what can we do as healthcare professionals to let our transgender community know that we care about them and want to help them and are doing the best that we can by them? One of the thoughts that I have come up with is having a transgender patient care coordinator associated with our practice here. This coordinator can meet with any transgender patients, kind of let them know that we recognize the situation and we fully respect who they are as a person and fully want to provide them with the best care as possible. That patient care coordinator can also do marketing, reach out to our community, let them know that we are working with other providers to facilitate treatment for them. There are people with mental health disorders that need to see a doctor, a provider, and they don't go because they don't feel understood by the provider that they're seeing or have seen at the time. So this is something that I would like you guys to keep in the forefront of your mind. It's affecting every single person in healthcare. No one is omitted, okay? The best that we can do for them is let them know we recognize it, let them know that we're on board to fix it, and let them know that we care about their health. If you get a chance, like and subscribe. Thank you so much and have a good day.